My name is Leanne Jones, and we're here for the Society of Thoracic Surgeons General Thoracic Surgery Database Monthly Webinar for today, Wednesday, October the 14th. I hope you all have had a good week so far. First, for our agenda items, we'll cover the welcome and introductions. We'll go over the STS updates. IQVIA will provide their update, and then we'll finish off the webinar with a user feedback session. You guys will have the opportunity to ask any questions, and we'll answer as many of your questions as possible. On the call with me today from the STS, I have Carol Crone. We have a lot of panelists today. We have Carol Crone, Jane Hahn, Addie, and myself from the STS. We also have a core group representative joining us today. We have Ruth Raleigh from the core group. From IQVIA team, we have Jeanette, Jean, Joe, Melanie, and Paul. So we have lots of panelists on today. Thank you, everyone, for joining. All righty, let's go ahead and hop into our STS updates. First, I'm going to touch on the general thoracic harvest update. As you all are aware, the spring 2020 harvest analysis is ongoing. The report period for the analysis will include data from July 1, 2017 up through 12/31/2019. And again, the analysis is underway, and the risk-adjusted results will be provided mid to late November. Obviously, we realize this delay is not ideal, but we are getting there. Progress is being made, and we will have these risk-adjusted results to you mid to late November. And also, there is a little sneak peek at the reporting that IQVIA will be providing at the end of this, with the IQVIA update. In terms of the reporting, educational materials and webinars on navigating the dashboard will be provided, so that information will be forthcoming once the data analysis is released. The fall 2020 harvest, as you all aware, has closed. The harvest did close on September the 25th. And that analysis reporting period will include data from July 1, 2017 up through 6/30/2020. That data is currently being prepped at IQVIA, being packaged up all nice and pretty, and is going to be sent over to DCRI for analysis. And please know that we are not anticipating that long delay in getting the fall 2020 harvest results to you. That will be a much faster turnaround. So please, keep that in mind. So we are not anticipating that big long delay that we've had with the spring harvest. The beauty of the ongoing continuous harvest, we are now accepting data for the spring 2021 harvest. We are accepting data up through 12/31/2020 will be accepted. We haven't established a harvest close date yet, but more information on the close date for the spring 2020 harvest will be coming very soon. For October training manual has been posted and is available out on the STS website. We do have a lot of questions that have been submitted recently. The core group did meet last week to begin answering questions, and we will be meeting again this week to continue addressing questions. So I am in the process of responding to FAQs. We did have a few that did need to be sent off to surgeons for input, so that information and your responses will be forthcoming. Again, we have one more meeting this week, and I will be responding to all of the questions that have been submitted thus far. In regards to the general thoracic 5.21 update, as you all are aware, the release go live for 5.21 was delayed until July 1, 2021. We will have the specs to the vendors in January, so they will have ample time to get the new version built and rolled out to their participants. As many of you, if you did attend AQO, Dr. Kozauer and Dr. Wormuth did present a presentation on proposed changes, and also a draft DCF were presented at AQO. So if you did download that draft DCF, please note that that is a draft. It is not yet final. There are still chances for some few minor tweaks, not a lot, but there's a possibility for some minor tweaks. We are in the process of cleaning up the procedures and diagnose and category disease sections. So those are two sections that have not yet been finalized. In regards to AQO, we just wanted to thank everyone that did attend. This was our highest attended AQO ever. I think final counts, we were a little over 800 participants. That's double what we've had in the past. So thank you to everyone for attending our very first virtual AQO. And thank you also to Ruth Raleigh for moderating our general thoracic session. She did an amazing job. Recordings from the live sessions are now available within the platform. All AQO sessions, the live recordings, and on-demand content will be available within the platform for an entire year. So if you did register, you do have the ability to go back and view any of those sessions for the next year. And also, if you do plan to get continuing education credit, your continuing education credit must be claimed by December 31st of 2020. So even though all the sessions will be available on the platform for the next year, literally up until the next AQO, you can only obtain your education credit up through December 31st of 2020. So be sure and put that on your calendar. You don't want to miss that date. Also coming up, we have our next new data manager webinar is scheduled for October the 29th at 1 p.m. Central. So if you know of any new data managers that may benefit, please check out our next new data manager session. Again, it's October the 29th. On the last user group call, we did complete our data manager survey. We do get a lot of questions from sites wondering about FTEs and data abstraction load, and we did cover a lot of these questions on our last data manager survey. We are in the process of taking all of those results from that survey on our last call and preparing them and putting them into a PowerPoint presentation. So those data manager survey results will be posted on the STS website here very soon. They'll be posted. I think we're going to post them under the data manager education section. But in the meantime, if you would like to check out that survey, if you were unable to make the call last time, that recording and the slides are available out on the STS website on the webinars page for review. And one last STS update, the direct data entry, as you all are aware, is available for the general thoracic surgery database. If you would like more information on direct data entry, you can email us at stsdb@sts.org, and Jane will be happy to give you more information regarding the direct data entry option for the general thoracic database. Okay, after AQO, I just wanted to clarify a couple of things. Just two questions that we've been getting a lot lately. Our first question, it seems like a trivial question, but we do get this all the time in terms of what cases do I have to enter for the general thoracic database. So the intent of the general thoracic database is to collect data for primary lung and esophageal cancers. So again, it's to collect data for the primary lung and esophageal cancers. Those are the required cases to be entered into the general thoracic surgery database. The non-primary lung and esophageal cancer cases are optional. So again, those are optional cases to be entered, but your primary lung and esophageal cancer cases are required. The other modules are not optional. The other modules are optional. They are not required, and these would be your thymus mediastinal mass resection, your tracheal resections, and your hiatal hernia and GERD sections. So again, those are optional. You can collect those within your own, collect data for your institution if you all wish, but those again are not required sections for data submission. Carol, I don't know if Carol or Ruth or had anyone had any additional clarification on that, if they wanted to provide any additional information.
Well, this is Carol.
Just not. Oh, okay. No, go ahead.
Okay. I was just going to say, for people who may not understand what primary lung and esophageal means, it means that it's not a metastasis to the lung or esophagus. It's the primary location of it's the primary tumor, the primary cancer. Ruth, did you have anything to add for that?
No, I think maybe where some of the confusion comes in is if people submit those cases, do they get analyzed or not? I think that that's sort of a common question. Leanne, I don't know if you want to elaborate on that a little bit. Mm-hmm. So if I choose to put in a non-primary lung cancer resection, what happens to it? Or what happens to that data?
Right.
So this, I can take that, Leanne, if you'd like.
Okay. Sure, go ahead.
Cases are not risk adjusted. They do go into some type of analysis, but it's not risk adjusted analysis. It might just be raw counts or things like that, but it's not risk adjusted. You will not get your observed to expected ratios on those cases, and they're not required to be entered in.
Right. We do provide some benchmark data for those, but it's not any risk adjusted data, but there is some benchmark data available for those cases.
Great, thank you.
All right. Our next AQO clarification that I wanted to bring up, I've gotten this question a lot lately, is someone wanted to know, did I hear correctly, is the 5-year follow-up going away with the new version? So yes, the task force did decide to retire these variables as we were not receiving adequate data to provide a meaningful analysis for this 5-year follow-up. Obviously the next question we get is, do I continue to collect this data for the current version? At this time, yes, we encourage you to continue to collect this data as we would like to, have a complete data set through the entire version. However, at AQO, one of the surgeons, did mention something about the new version will go live in July 2021. What about patients entered in the first 6 months of 2021? And it was suggested that, you would not need to continue follow-up on those patients for the first 6 months of 2021. But actually, Carol and I are going to be taking this back to the task force and have further discussion about this, just so we can clarify and get a final answer. And I'm sorry, I didn't even finish my thought there on the slide there, so I apologize. I'll clean that up for posting. So the task force is going to continue discussing this, and we will get a final decision on if participants should continue to collect this 5-year follow-up for this current version. If not, when would be like the cutoff date? What would the task force recommend for the data managers to stop collecting this follow-up data? So more information will be coming once the task force discusses that this month. We'll provide clarification in the training manual as well as in upcoming webinars. Next, that's all that I have in regards to the STS updates. Next, I wanted to turn things over to the IQVIA team so they can provide their updates. So I'm going to turn things over to Joe.
All right, great. Thanks, Leanne. Hi, everyone. Good afternoon. I'm going to go into some updates that went into effect over this past weekend on the 10th. Starting with the missing variable report, a couple bugs there, STS 3656 as well as STS 3624. The clinical staging method, esophageal for EBUS and mediastatinoscopy were appearing on the MVR as missing, even though they're not required for version 2.41. And so that should now be resolved. And then STS 3686, the missing variable report had been showing missing data for the patient participating in an STS-related clinical trial variable, though it is answered in your vendor system. And so that seemed to have to do with something with the demographics form, the version rather of the demographics form. And so that should now be resolved as well. And then also now currently in effect are a couple enhancements to the harvest summary report, STS 3122 and 3123. That harvest summary report should now display the total number of records as well as the surgery date that was selected when the report was run. So that information should now be displayed in a little panel at the top of the screen. All right, and then a couple issues under review, starting with, next slide, Leanne. Thank you. Missing variable report, STS 3924. We have received a report that the patient alive at 90 days post-procedure variable is being flagged as missing, even in situations where it has not yet been 90 days since the surgery date. So that is something we are working on. And then STS 3884, the clinical staging method for lung, PET or PET-CT variable may be referencing the wrong parent field. And so it's appearing on the report when it should not. We're looking into that report as well. The dashboard, STS 3845, we are reviewing a report that the 30-day mortality variable on the dashboard is not displaying results correctly. And so we are looking in to make sure that all those numbers get categorized under the appropriate section, and so that those results are accurate. That's all I had for issues to mention. Just note that if you did report something that you didn't see listed here or discussed today, we are indeed still investigating that issue. If you ever want an update or if you want more information on what you've reported, feel free to follow up on those tickets or respond to the RITM ticket that you had logged, and we can provide those updates for you.
Great.
And that's all I had.
Thank you so much, Joe. Thank you so much. I appreciate it. Next, we're going to turn things over to Melanie for the GTSD risk-adjusted dashboard report. So, Mel?
Hi, Leanne. Hi, everyone. Okay, so this is, we wanted to go ahead and show you some concepts of what's coming. And starting off with, when you navigate, this will be a brand new report that will be available within the platform. So underneath your operational reports, where you have, of course, your other reports, you'll see a new link once that's available. That will be the GTSD risk adjusted dashboard. And when you access that report, it will be driven by a date parameter. And once that date parameter is selected and you're navigated to the actual report, you will be viewing a page like this. So this interface will then break up that report into different sections. So you can see we have lung cancer and the associated reports, esophageal cancer, other reports, and benchmark reports. So you will have this main homepage dashboard, and you'll also have the ability to be able to export all of the components for the report in one action. So you'll see the very upper right corner, there is a button that says export to PDF. So once you select that actual button, it will generate all of the different components and provide you one single PDF result. Let's go to the next slide. So just to give you a high level of what some of the reports will look like, we'll use this example of lobectomy, which is going to be the STS and NIS comparison report. And here you'll have different sections that will be in a tabular format, and then underneath the tabular format, you will have a graph. And that graph is interactive. You can't see it on this, this particular screenshot, but there will be a slider that will allow you to adjust and view the different sections within that actual graph so that you can see that condensed view. And again, once we get closer to releasing the report, we will be, of course, going through a walkthrough with you all and providing educational material to, of course, cover the different pieces and how to navigate within the report also. But this is the general layout for this specific report. So we just wanted to allow you to at least see what you will be viewing. Let's go ahead and go to the next slide. And you'll see here we have the example for lobectomy for lung cancer composite quality rating. And so here you will again have that tabular format at the very top. And here you'll have the ratings, and below that you'll see that there is a legend to advise in regards to what those star ratings indicate. And then below you'll have the, again, graph format down at the bottom, and there will be an interactive slide for you to be able to adjust and zoom in on the particular sections within the results. Okay, and then also let me just point out that at the very top right, you'll see that there is a home icon that will always bring you back to that page where we initially started out. So that will bring you back to that main location where you had all of the different categories with associated reports. Okay, let's go to the next slide. And here you'll see that we have the lobectomy for lung cancer composite quality rating. And here you'll have the ability to be able to review those quality domains, view the eligible procedures, and the details associated with each. And the count section which will provide you the specific results and counts, and you will have the ability to drill down. So you'll see that each one of those counts is highlighted in that hyperlink blue, and you will be able to select that actual count, and it will present the results down in the bottom portion of the report. And then of course you have that last column, which is the percentage. Okay, and I believe this may be the last, oh, nope, here we go, missing data. We do have this layout for the missing data report section. And so you will be able to review that information. And it looks like we are able to give specific details and drill downs. That's what you see down below, to be able to select that value and then see the information down in the bottom portion of that report. And again, just as we go through each one of these reports, you would always click on your home page to navigate you back to, of course, that main interface. And let's go to the next slide. I think I do have a benchmark, maybe. Nope, I thought I did. Thought I had one, but we wanted to give you at least a preview of what's coming, and just so that you all are able to see that not only are you going to be able to get that high level information, you'll be able to do drill down capability to hone in and see that information at a patient level also. So I will stop there and turn it back over to Leanne.
Yeah, that's great. Thanks, Mel. I know a lot of the times when that drill down information is very important, we would always get questions of which patients, you know, which patients were included in those specific counts. So this having that drill down capability here is super awesome. So that's going to be really great for the participants. So we appreciate all you guys' hard work on that.
Awesome.
All right. Thank you. All right, next we're just going to finish up with our typical slides. You guys are all used to seeing these final slides. Of course, our IQVIA support plan, which you are all very familiar with. Just a friendly reminder to when you are contacting IQVIA or STS, please be sure to include your participant ID number in any and all communications with STS and IQVIA. It's extremely helpful to know which participant we are dealing with, and which, especially for those participants that have the site, people that have multiple sites. So please be sure to include your participant ID with your communications. Here we have a list of all the resources available to you out on the STS database webpage. We have our resource documents listed there, as well as our STS National Database Feedback Form. And also we have the phone support number for IQVIA, as well as the tech support email. My contact information is listed here. If you have any questions regarding the thoracic database, if you have any questions in general regarding STS, if you're not sure who to contact, please feel free to reach out to me directly. If I cannot answer your questions, I'll be sure to get you in touch with the appropriate staff person. For database operational questions, these types of questions would include questions regarding the current contacts listed for your site, questions regarding participation agreements, questions regarding direct data entry. Please feel free to email us at stsdb@sts.org. And again, if you're not sure who to email, just send me an email and I'll get you in touch with the appropriate staff. Our next general thoracic webinars, be sure to mark your calendars. Our next user group call is scheduled for October the 28th at 2:30 Central. And then our next monthly webinar is scheduled for November the 11th at 1:30 Central. So please be sure to mark your calendars and join us for our next webinars. Next, I'm going to turn things over to you all. We have a few questions coming in. So again, please be sure to submit your questions using the Q&A function. We'll answer as many questions as possible, and we encourage your feedback. We want to hear from you. If you have any questions related to AQO, let us know. If you have any questions related to the information that Melanie just presented, please just let us know, and we're going to go ahead and tackle some questions we've got coming in. So let's go ahead and get started. Let's see here. Our first question, in reviewing the manual, there was a question submitted in May regarding the inability to perform PFTs during the COVID crisis. The reply to that May 2020 question was to check no and patient unable to perform. Can we have a more defined timeline? Would this apply to all of 2020? And that is a great question. Carol, I know the surgeon leaders have been in discussions regarding this, the COVID questions for that we're currently collecting. Have they determined, I assume we just continue collecting as we have been. Have they established a more defined timeline as of yet?
It's a good question. And Leanne, this is Carol. I don't know that we have a more defined timeline yet, but I think it is something we need to bring back to the surgeons to get their guidance on. Ruth, did you have
Absolutely.
any thoughts on that?
No, I think they're trying to be cognizant of the fact that it's hard to predict when the COVID crisis will end and that it's sort of regional. So while things may look great in South Dakota, they may not look good in Michigan, and people may not have returned to PFT testing at individual sites. So I think it's pretty hard to predict an end point at this point. So I think it'll be challenging.
Yeah, that's a great point.
Yeah,
We can bring it back to the
that is a great point.
to get clarification, Leanne.
Yeah, absolutely. And as we stated earlier, we do have a task force call this month, so I'm going to put that. I'm writing that down right now as a list to possibly add as an agenda item if we don't get to discuss it sooner with Benj and Felix and others. So, but as of right now, I'll just continue to collect and code accordingly as to what's currently in the training manual. Our next question, does it hurt us in any way for submitting optional cases, and does it affect our quality rating? So no, it does not hurt you in any way. It does not impact your quality rating at all. I don't know if anyone, Carol, did you have anything else to add there? Mainly for, those optional cases, it's for you all to enter that data and use it for your internal reporting purposes. Any other thoughts, Carol?
No, I agree with you. And I would just, if any site is, if any person is, discussing it or trying to decide if those cases should be entered or not, I would just suggest talking with your administrators and your surgeons to make sure that everybody's on the same page. Because I think that some sites are entering all of those cases under direction of their surgeons or administration, particularly for like certificate of need states or programs that are using the database as a catch-all for all of their surgeries. So just make sure you discuss it with others before you make that decision.
Great, thank you. All right. Our next question, it seems maybe IQVIA related, will the drill down capability be available as soon as data is submitted or not until data deadlines?
This is Jeanette. I can take that one. So the drill down capability in any report is, it's available in that report, but the different reports in the system have different data sources. So what was shown today with the risk adjusted reports that are coming, those are on the data set post-harvest analysis. So you wouldn't be able to see the analyzed data set in that report until after the harvest closed. If you were looking at, say, the harvest summary report or the missing variable report or the non-analyzed dashboard, those also have drill down capabilities, and the data in those reports is available right away as soon as you've submitted it. So hopefully that answers your question. If not, please post another in the Q&A section.
Great, thank you, Jeanette. Our next question is the 5-year follow-up required or voluntary? So when the 241 data specifications data collection form was created, the hope was for, the follow-up to be completed for your cancer patients. Obviously, as the data collection has gone on and we've looked at frequencies, that is not, we haven't been getting the data that we had hoped, hence why we are retiring those variables for the next, retiring that 5-year follow-up for the next version. Again, we're going to follow up with the task force to see if they would like for our data managers to continue to collect that data through the end of this version, or if they think it's not necessary. So, but at this time, we would, encourage you to continue to follow the specs until we have further clarification from the task force. And again, we will follow up as soon as we have that final information. Again, we'll put that in the training manual, as well as we'll provide updates on the next webinar. So more information coming soon about the 5-year follow-up. Our next question, I missed the beginning of the webinar. When will this be posted, or how can I get the slides? Kelly, I'm assuming you're talking about the slides from this session. If not, let me know, but this slide deck will be posted within the next couple of days after the webinar. Should be available by the end of this week. Marketing's usually really quick about getting this information up. If not, if you need the slides, rather quickly, you can just email me and I can send you a copy of the slide deck, if this is what you were asking about. Let's see here. Our next question, when entering non-analyzed cases, for example, a wedge resection for ILD, please clarify if we are supposed to enter the full analyzed DCF form for these cases.
Sounds like a great question for Ruth.
Yeah.
Oh, Ruth, if you're there.
She on.
Sorry, my computer was fighting me. I couldn't get it to mute. So no, you should not enter. So it's sort of preference, to be honest, because the data isn't going anywhere for usage anyways. If your site chooses to collect all of those data points because your institution is going to use it for something internally, and your surgeons really want you to collect all of that data, then you certainly can. But the STS doesn't require it and isn't going to use it for anything. So unless you have like strong institutional pressure and they're going to use it, and then I would not enter all of that information.
Okay, great. Thank you, Ruth. Our next question, if the final pathology for an esophageal case is TIS and there is no histological grade documented, do we leave it blank? My surgeon said that pathology cannot determine a grade for this because there is no residual tumor. That's a good question, Mindy. I don't know if this is something, Ruth, that we would want to be, have we answered this before? I can't remember off the top of my head.
I was looking in the training manual. We've answered something similar to this before. I was looking in the training manual to see if I could find it really quickly, and unfortunately, it's going to take me a little bit longer than we have time for right now. So if you have a lot of esophageal cancer is treated and then there's no disease left at the time of resection. And then we've been directed to use previous pathology results for histology, for example. But I'm not sure specifically in a TIS case if that's what, we might need to see the actual path report. So I would submit this one to the court.
Yeah. So Mindy, if you could submit that, that would be great. Actually, we have a call tomorrow. So if you get it submitted, we can actually discuss that tomorrow on our call. So we would definitely like to discuss as a group before we provide any type of answer. So we can make sure we're all have consensus and all on the same page. Our next question, what is the process for informing users when the issues that they have reported have been corrected? Will the user receive an email, or is correction only reported in the notification section of the IQVIA website? That is a great question, Claudette.
It is a great question. This is Jeanette. Jean or Joe, would you like to take that one?
I was going to.
Great.
Yay. Hi, this is Jean. So Claudette, thank you for asking that question. The process basically is that if there is a ticket open, then the agent will respond to you via the ticket, via email. And once it's corrected, sometimes it might seem like it's a long while, but we do need to make sure we're reviewing and that we get that corrected the first time. And then, so basically, yes, the answer will be that you will get an email. And I don't think we update the notification board. Jeanette, can you kind of chime in on that one, that piece of it? I don't think that we just leave it out there, I think, or do we?
We do post an updated notification, yes.
Okay, great, thanks. Thanks.
Okay, great. Thank you. Let's see here. How is the 5-year follow-up tracked for completeness if each harvest submission period only covers a 3-year period? So again, this is a great question. Carol, I don't know if you have any input here, but again, you know, the 5-year follow-up, we looked at frequencies for the 5-year follow-up with the data coming in, and we're just not getting the information that the surgeons had hoped for. I don't know if you wanted to provide anything on additional clarification on that, Carol.
I can provide a little bit addition. This is Carol, a little bit of additional information. One of the other reasons why the surgeons decided to retire those elements, which everybody has worked really hard to get, is because of the burden on the data managers, and it just wasn't worth the. As Dr. Jacobs put it, is the squeeze worth the juice? And it's just too much work for data managers to be doing that type of follow-up and getting that information, following folks for 5 years back. Related to the analysis of the 3 years, you are updating those cases hopefully, you know, whenever their year is up or whenever the year has passed for those patients, and it's being looked at from that standpoint. So the 3-year analysis doesn't really have too much to do with it besides I think that we're missing those, and that's a really good point, and I think that's something we'll probably take back to the surgeons, is if you're updating it and you're not submitting those cases back to 5 years and you're only submitting those cases back to 3 years, and I think that's another issue. But I believe, Ruth, how are people submitting those cases? Is everybody going back and submitting 5 years worth of data?
That's generally what I do.
Yeah, so hopefully it's being updated when you submit those that large group, that large time frame. But honestly, it had a lot to do with we're just not doing anything with this data like we thought we were going to, and also it's a very difficult and a big burden for the sites to collect.
Yeah, and that ties into exactly, you know, the next question, you know, was, but the question was for the 5-year follow-up, if it was required. For the past, say, the last 6 years, are you required to go back and do those? That's a tremendous amount of ask, I think, for a data manager. So I think that ties into exactly the points that you were just making, Carol. That's a big ask. That's a lot of data entry burden. Let's see here. Our next question. Are patients that have had chemo and radiation before their lobectomy and then die within 30 days risks out of the mortality? In other words, do they count? And to be honest, Mindy, I don't know the answer to that off the top of my head. I would have to look into that. Unless Carol or Ruth know off the top of their head, I would have to go back and reference the documentation, to be honest.
I agree. I don't know off the top of my head.
Yeah, I don't know.
Yeah, and I don't know, I don't believe that these patients are excluded, but I think we would have to verify. It would be in the manual, so we'll have to check, we can check that out.
Yeah. So Mindy, if you wanted to email that to me directly, I'll follow up with you after. I'll have to look into that and then follow that up. Let's see, our next question says, can someone from IQVIA provide clarification on the missing variable summary? Is it a new report every time I run it? I'm still having issues in which the NVR lists records that have erroneous errors in which demographic fields are listed as missing that are in fact correctly entered. I believe this was a bug that IQVIA had fixed months ago, so I'm confused as to why the NVR still quote sees them. Thank you.
This is Jeanette. I'm just pausing dramatically because I'm rereading the entirety of your comment.
Yeah, that's
there's
fine.
a lot there.
That's why I left it. I know, I left it up there.
Thank you. So the missing variable report will run based on the current state of your submissions as they stand when the report is run. So if you run the report and you don't do any submissions, new submissions, and you run the same, you run it again the next day, it would be the same data, but it's going to run based on the state of data that's in the system from your most recent submissions. So not exactly a new report every time you run it, but it does consider the latest submission information that you have for the date range that you've selected or that you're reviewing. If you are having issues in which the MVR lists records with erroneous errors, we definitely would want to look into that for you. I don't know whether you've reached out to the IQVIA team about this situation, but if you haven't, if you could please do that, we will definitely look into the specifics here. We certainly, you know, there have been fixes and improvements in the MVR. So, you know, we are hopeful that we've fixed a number of items here, but if there is anything outstanding, we definitely would want to work with you to understand what that is and to resolve or potentially clarify, you know, if there's something that's just maybe not clear to you. So if you could reach out to us, I believe it's ststechsupport@iqvia.com with the specifics if you've not already. If you have already, thank you very much. I know Jean and Joe will be pulling up your tickets to double check.
Okay. Thank you. Let's see here. All right, let me clear that. Okay, and Mary's saying she had emailed IQVIA back in August, and she's going to go back and see if she can find the ticket number for reference. Thank you, Mary. Let's see, our next question. Are cases where the resection questions have all no answers the same as when they are all left blank or not answered? Are cases of all no and all blank considered non-analyzed? Are cases where the resection questions have all no answers?
I think I would have to look at the form. I'm not sure which resection questions. Without looking at the form, I'm sorry. Let me pull it up. If you want to come back, I'll pull it up real quick.
Yeah, that's fine. Let's see here. I'm going to try and pull it up too. Our next question, what is there to benchmark on decortications? Now, if we are supposed to use the non-analyzed DCF, no risk factors, no post-op events are collected while using the non-analyzed DCF. Basically, only demographics, admission info, mortality status, discharge, and follow-up is collected. So I know, and then this is probably a great question for Dr. Wormuth, but he's not on the call today. And I know in the current dashboard, we give counts. But I don't, to be honest, I'm not sure of what benchmark data will be, if any, will be provided for like the decortications. Carol, do you have anything to add, or are you aware of anything? But I think that's a great question for Dr. Wormuth.
No, and I think he said we don't have to, I can't remember exactly what he said on the decortications, but it's up to the site, I guess, which form that they want to use, if they use the analyzed or non-analyzed DCF, if they want to get those additional demographics on the patient.
Yeah.
I would generally just caution using that data for benchmarking anymore, though, because you're not going to get a good sample size because so many sites are no longer entering them. So you really aren't comparing your site to all STS sites anymore. You're comparing your site to STS sites that are choosing to still participate in something that's not even an optional module, because decortication isn't even an optional module. So I think to use that data for benchmarking would be, I would just be very cautious doing that.
That's a great point, Ruth.
That's important. Thank you.
And we're back to Claudette's question. I don't know if you've got, I was trying to pull up the DCF as well, but I have not gotten there yet. I am working on it.
I'm scrolling through it really
and
quickly.
Again, I'm sorry, what?
I'm scrolling through it really quickly, trying to find the section. I think she's talking about where I'm not sure. Maybe I'm not sure what she's referencing to the resection questions. Maybe if she could submit some further detail, I'm happy to take a look at it and get back to her.
Yeah, that'd be great. And Mary was just clarifying about, in the last harvest report, there was a decortication section that was analyzed, even though the procedure had become non-analyzed. And I remember Dr. Wormuth say that was legacy left over from the previous version. and that would not be continued. So that was just legacy reporting from the previous version. So thank you, Mary, for jogging my memory. And again, Claudette, we'll get back to you if you want to just email me directly. Ruth and I will follow up with you regarding that question. We just don't want to tell you anything incorrect if we don't, while we're looking into it. I don't see any other questions coming in at this time. I don't know if anyone has anything they'd like to add that I may have missed.
This is
Just
Carol.
want to be respectful of everyone's time.
I'm sorry, Leanne. It's Carol. I think I
Go
understand
ahead.
what Claudette is asking.
Okay.
Maybe this is just a general question, but I think the question is where there's all no answers, is that the same as when they are left blank or not answered? And if they're left blank, they usually default, or missing, they usually default to no or whatever the lowest risk is.
Okay.
For those cases.
Right. Gotcha. And if that's not,
Question.
yeah, if that's not what you're asking, we'll follow up. But yeah, just let us know. Thank you, Carol. All right. I don't see any additional questions. Again, I want to be respectful of everyone's time. If no one has anything else to add, I just wanted to thank everyone for joining us today. Again, if you do have any questions or need anything, please feel free to email me directly. You can reach me via email or phone. So please feel free to reach out. If not, if I don't have anything else, I just want to again thank everyone for joining us today, and we will catch you all on our next webinar, which is scheduled for our next user group call scheduled for October the 28th at 2:30 Central Time. So we appreciate it. Thank you, everyone, and thank you, Ruth and STS and IQVIA teams for joining today. And we will follow up on our next webinar on October 28th. Thank you, everyone.
Great job, Leanne. Great job, Ruth. Thank you so much for joining us.
Thanks, Ruth. Thanks, STS. Thanks, IQVIA.
When we ask the surgeons, Leanne, we can put that in the notes with them so we don't forget to ask.
Yeah,
I think that's important.
yeah. That's very important. Yeah, because it's just, that's a lot of work that the data managers put into that. And I know it's frustrating.
Yeah, we don't want to be disrespectful to their, to that.
Yeah. Mm-hmm.
Okay.
Hi, Ruth.
Great,
I think
thanks.
Ruth's still on. But yeah, that's a great point.
Yeah.
No, that was a great point, Ruth. It's very important, and we need to make sure that we, convey that to the surgeons, and because we don't want to be disrespectful. It's a lot of work that data managers put into that.
Yeah, especially when, it sounds like some sites never put any data in that field at all. And for sites that were doing it every 6 months as they were requested to do it, like that's a significant amount of time and dollars that were spent on that. And so, it's hard because I almost want to say, well, don't make other people, waste their time on it if we're not going to use it. But also, that was the requirement. And if we're going to say we require sites who participate to participate fully, then it sort of goes against that. So it's challenging. I don't envy you trying to sort that one out.
No, it's tricky because we don't want to be disrespectful of everybody's hard work, but we also don't want to cause unnecessary work. So
yeah,
we'll probably loop in on that one to make sure we're doing the right thing.
Yeah, absolutely.
Okay.
Ruth, thank you so much for joining today, and that was awesome. Your help was greatly appreciated. So thank you.
Yeah. Sorry about my mute button. I was trying to look in the training manual for that answer, and so I couldn't get the Zoom back up. I was reading the training manual.
Oh no!
I was my dog to steal the phone.
I talk on mute all the time. It's okay.
Thank you. Have a good day.
All right. Thanks, guys. Have a great day.
Bye.
Bye.